think the difference with my approach is that I am trained as a craniofacial surgeon, so I do jaw surgery. I do big movements of facial bones, the chin, not just the chin, but the entire mandible, the maxilla. And so my approach is very much along the same lines, that I can address the structure itself as opposed to masking the situation. An implant, in a sense, is a mask. It does give you some structural support, but not as much as a bone reshaping or bone movement. Once again, the main reason is because all of that soft tissue is still attached to the bone. So when we move the soft tissue forward, it pulls with it, when we move the bone forward, rather, it pulls with it all of the musculature and the soft tissue. So when I approach a simple chin, and I say simple because in comparison to orthognathic surgery, which is big jaw surgery where we'll move the entire mandible, when I approach a simple chin, I approach it in exactly the same way as I approach a big orthognathic procedure. All my patients are seen by the same orthodontist that I send my orthognathic patients to, for a number of reasons. First of all, to ensure that I'm accurate in terms of where to place the chin or how big to make the implant. Even my implant patients I send to get cephalograms and measurements to just improve the accuracy. Once again, I approach it exactly as I would a big orthognathic procedure where I'm moving the entire jaw. The other advantage of that is we can mask underlying jaw discrepancies, not just chin discrepancies, but disproportions of the entire jaw with smaller, less invasive procedures, like a sliding genioplasty. Depending on the direction of the movement and whether or not we give it vertical height, or whether we add bone graft or we take away vertical height, we can actually mimic what would otherwise be a big surgery to try and optimize facial proportion. So I have that in mind, as opposed to just thinking, well, I need to stick an implant in there. I'm thinking along the lines of, how do I optimize all of the facial proportion? It's not just the chin that's a problem in this patient, it's the entire jaw seems a little small, or there's a lack of vertical height. And so I take that entire picture into mind, and I think that's a consequence of my training and my practice as a craniofacial surgeon.